Hello, I'm Dr. Gloria Kaye, and I'm a healer. We're going to be talking about chronic and acute pain. I'm going to begin by showing you some very simple and yet profound exercises. The first one will be a neck roll, and this will help you release tension in the neck and the shoulders. So to begin, you lower your head and relax as you lower your head. And now very slowly move your head in a clockwise rotation. Very slowly. If you find you're having any difficulty, any distress doing this, just narrow the magnitude of the circle. But move very slowly and you'll find that the releases you get are pretty phenomenal. So very slowly, all the way around. Moving slowly in a full clockwise rotation. And when you get to center again, you move in a counterclockwise rotation. If you have any distress, just narrow the magnitude of the rotation. Slowly moving in a counterclockwise direction. This also helps to create a sense of relaxation. And there you have a very slow, healing neck roll. The next thing I'd like to show you is a variation of a shoulder shrug. So for this, lower your head as you lift your shoulder. Come back to center. And then go to the other side, lifting your shoulder and dropping your head. And back to center. And once again, lift your shoulder, drop your head. And back to center. And lift your shoulder and drop your head. And back to center. Very easy ways to relax the body, relax the neck, and relax the shoulders. Well, you've now seen how energetic healing can affect shoulders and neck. I'm now going to show you how you can use an energetic intervention on knees. I will tell you that Dawn has had knee surgery. It's been very, very successful. However, I'm going to attempt to lighten the scar. Now, you won't be able to see this, but I'm going to place my hands on his knees as if there were still a problem. So the first thing I'm going to do, Dawn, if I may, is to place both hands on your knees. Now, a lot of times people will come to me and they'll say, oh, I have bone on bone, I need surgery, and I'll say, well, give me a chance, because what I want to do with bone on bone is to create some space between the bone. And I do this energetically, and there's a specific stretch that I'm going to show that anyone can actually do. But first, again, gently, patiently place your hands right on the knees. Yes. So, Don, I'm sensing that there's an energy beginning to move in your knees, And again, the way I sense that is there's a softening under my fingers. So I'm just going to hold for another moment. This is pretty profound. It's getting hot. Okay. So again, if someone came to me with an issue of the knee, I would be holding even longer than this. But at this time, I can feel a nice energetic flowing through both knees. And even though the knee might just be affected on one side, it's important to address both knees. All right, if you would be kind enough to straighten your leg and put your knee over, put your foot over here.
My leg.
Yes.
Okay, it's all yours.
Okay, good. So the stretch is a little complicated. The first thing I'm going to ask Don to do is to hold here. So he's right at the groin with his fingers and a little pressure. And that way, when I give a little traction to the leg, he'll be assisting me by holding this end. You can feel that?
Mm-hmm.
So again, we're holding, we're stretching, we're asking. That's another point. We're asking the body to correct. So I previously talked about expectations, and I would like to modify that and say that yes, we can ask the body to respond. All right, and if I may take this off?
Yeah.
Okay, so just going to slip this off. That was uncomplicated. And I'm going to place my hand right here on the heel. And again, give a little traction. So I am pulling from underneath. And most times when people come to me with knee issues, they walk out of the office feeling much better. And not necessarily 100% better first time around, but usually within 3 sessions, we are fully successful. So again, I'm moving the body in 2 directions. I'm pulling here, so I'm pulling at the heel, and I'm pushing here. So you can see I'm giving the leg a 2-way stretch. So even though the issue is the knee, you need to work around it. And when Don presses here, he's assisting me by giving me a little tug. So I just want to review this if you want to try this stretch at home. Clasping the heel and moving the rest of the leg away from the heel. So I'm pushing in this direction and pulling in this direction. And that takes a lot of tension off of the knee. Energetic interventions are good for addressing all issues related to post-surgical trauma. So in most cases, there's a tube that's inserted when you're out. You had that experience. And with all due respect, many physicians take that very lightly. But I've seen people really be bothered by the after effects of that for several weeks. You know, it's a thickening in the throat and just an overall irritation. Mm-hmm. So that's been resolved?
Yes.
So that's one thing. The other thing, people get black and blue. People get black and blue. And energetic interventions will address the black and blue and the soreness. So black and blue will turn to yellow very quickly, and the soreness hopefully will resolve. So again, I'm using 2 points of insertion. One is the knee, and one is right at the hip area. Mm-hmm. So we had a little discussion, and Bev said, yes, she can feel warmth, and it's feeling better.
Yeah, it is. Feels good.
And I'm moving my hand away from the site to, again, energetically infuse your whole leg. Mm. And this works cellularly. So cells are reorganized or dispersed, or in your case, they're regenerated. So where you've had trauma now, additional cells should be plumping up and really assisting you in your life.
Great.
Yeah.
It's exciting.
It is exciting. So in addition to the trauma you experienced here, I can see how your whole body has been traumatized. And the way I see that is with the imbalances in your face.
Mm-hmm.
You're aware of that?
No,
No.
but I don't have any makeup on, so.
No, it doesn't have to do with makeup. It actually has to do with structure. So I'm just, if you don't mind, I'll touch you gently here.
Okay.
And we'll see if we can make some changes. So again, this kind of trauma can affect your bite, the angling of your eyes. And what I noticed more than anything was the imbalance in the cheekbones. And it's nothing you did. I mean, your body was just traumatized. That's what surgery does. I mean, surgery is absolutely essential in many, many cases. But, think about when you just cut your finger, that's a trauma. Mm-hmm. And then you have a major surgery, that's really a trauma. Mm-hmm. All right. Do you feel a softening in your face now?
Yeah, I do.
Yeah.
Yeah. It's gentle.
It's a
Subtle. Yeah.
gentle and subtle.
Yeah.
Energetic interventions work very well with the hands. If you hold gently and have no expectations, and sometimes just tap on the area, you'll begin to feel a change. So I began by tapping, and now I'm holding. And if it's a very, very intense arthritic knob, and we're not looking at arthritic knobs here, we're just looking at enlarged knuckles, you might want to take some tissue that's been wet and place it right on top of the knob that you're trying to dissipate. And again, a very, very soft intervention. And just let that energy flow. So again, gently and patience, and the intention is to help you as much as I can. My attitude is one actually of gratitude that we're able to have this time together and do this. And now I'm beginning to feel this movement through your body. All right, again, it's very subtle, but it's definitely happening in your hand. So I'm just going to hold here for a moment, and then I'm going to show you something that you can do for just about any hand issue. But I'll hold here just for another second or two. Yes. Okay. So the intervention that requires stretching is the following. You interlace your hands, your fingers with your friend, hold the shoulder, again creating length in the arm, moving down to the hands. And you can feel this energy moving through your body, through your arm, actually going up to your head. I thank you. I hope that you found this interesting, inviting, and useful.